cases here in Dominica as far as the vaccination is concerned. We're at 38%. We still have a bit of a ways to go to hit that target of 70%. And Mrs. Mignon Rule Shillingford, the coordinator of the Health Promotion Unit, will give some more details about what that 70% actually means. Mrs. Shillingford.
The Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvine McIntyre, Permanent Secretary in the Ministry of Health and Wellness and New Health Investment, Letitia Lestrade Wyke, National Epidemiologist, Dr. Sholadin Ahmed, Deputy Chief of Police, Davidson Valerie, our moderator, Ms. Sheena Harry, ladies and gentlemen, and media, good evening. This evening, I wish to focus on three things. One, to continue what Dr. Ahmed has started off and to thank the population of Dominica for all they have done thus far in the fight against this COVID-19 pandemic, and even more specifically, in relation to our vaccination rollout strategy taking place at present. I also want to speak to those in the public who still have some hesitancy in taking the vaccine, and to impress upon you the need to continue to comply with all COVID-19 protocols at this time. To date, as mentioned earlier, we have vaccinated over 17,674 persons with the COVID vaccine in Dominica. While we hoped that the numbers would have been significantly greater at this time, we at the Ministry of Health are thankful and would like to say a humongous thank you to all of the public who have taken the vaccine and have by that measure started our journey to achieving herd immunity. To the different establishments and institutions such as the public service, healthcare workers, our supermarket owners and their staff, the wholesalers, financial institutions, faith-based organizations, hoteliers, diaspora, entertainers, I wish to say thank you to you, the employers, for taking the vaccine, and also for motivating your employees in taking the vaccines, and in some instances, facilitating by providing time and transportation to the various vaccination venues. To the parliamentarians, national councils, and other leaders who took the vaccine, we also say thank you. And please, do not keep the reason you made the decision to take the vaccine to yourself. Share with all the people you love and represent, so they too can be empowered to take the vaccines. To the members of the other organizations, like the Dominica Red Cross, who have been volunteering at all our vaccination centers and have also provided mobile vaccination flasks. To the International Organization for Migration, IOM, who have assisted in allowing us to send out necessary public service announcements in various languages and also supporting the hotline, we say thank you. To entertainers such as Tasha P. and Mr. Peter Later, aka Mighty Pigtail, for the Take the Vaccine jingle. Take the vaccine! And our cultural ambassador, Wayne Benjamin, and James Rodney from the Triple K Band. I also want to say thank you to our very own captain of the national football team, Glenson Prince, for your advocacy. I also want to say thank you to all other persons in whatever way you have utilized through social media and any of your other pages your taking the vaccine and also experience, we say thank you. To the various media houses who have consistently given way to our request to appear on your various radio programs and for providing the public with correct, clear, and up-to-date information, we say thank you. and we would appreciate it if it continues. To all the other key groups like our educators and teachers, DHTA, DIC, financial institutions, the clergy of all denominations, thank you for allowing us the time which we were able to empower you and inform you about COVID-19 vaccines, and that you are better able to communicate with your congregation. Please do not stop. We need to continue until this deadly virus is at bay. Please permit me now to speak to the rest of the population who are still hesitant in taking the COVID-19 vaccines. Vaccines are simple, safe, and effective way of preventing spread of infectious diseases. Side effects are usually minor, and they have been around for centuries. They are also responsible for the elimination and reduction of several infectious diseases in the world today. And to name a few, MMR, measles, mumps, and rubella, tetanus, polio, and even TB. One of the things I must say to you that even if WHO and PAHO did an emergency use of a number of vaccines, there are some development stages that all vaccines must go through. They include 1, computer algorithms used to model how vaccines will interact with the immune system. After this is done, it moves to testing in cells or in a test tube or culture. And when they are satisfied with some of the information, then they move to animal trials. After they have done the animal trials, they move to human testing. And this happened in 3 stages, increasing the number of persons that are tested at every stage. After this stage is completed and they were satisfied with what we call the efficacy, how well it works, or if the vaccine works according to what they want to prevent, that is when they apply for licensure to be able to put these vaccines into the market. Now, the COVID-19 vaccines were made quickly because the science was already being studied or existing. It's not the first time a coronavirus has affected the world. We had MERS, which is the Middle Eastern Respiratory Syndrome, in 2012. And as you may remember, we also had SARS, which was the Severe Acute Respiratory Syndrome in 2003. Scientists also envisioned or predicted that a respiratory disease would return and have a significant impact on the world. Also, because of the fact that on January 30th, 2020, WHO and PAHO noted that this COVID-19 pandemic was now a public health emergency of international concern. This caused a lot of negative impact worldwide, disruption of livelihoods, death, damage to the economy, increased domestic abuse, disabilities, and also affecting mental health. To add to that, all of our best scientists, with all the skills that they have had acquired over the years, was working on a vaccine. Also, a lot of resources would have been placed in making the vaccine. So let's speak to some of the facts about this COVID-19 vaccine. If vaccinated, if you do contract the virus, you will not get a severe form of COVID-19 that will require hospitalization. In the UK, where over 35 million persons have already been vaccinated, there is already a 94% plus drop in hospital admissions. Over 600 million people worldwide have already received the vaccine. New information is showing a reduce in the viral loads and shedding in persons who have taken the vaccine, causing a reduction in transmission of the virus in the amount of 67%. So we are already confirming that if you take the vaccine, and more specifically the Oxford AstraZeneca in this case, transmission is reduced. All vaccines in Dominica present at the time has a higher than 79% efficacy rate. In the case of variants and mutation occurrence, there must be replication, and that occurs from persons to person. We are the host. So if you are really concerned about mutations and variation, if we continue to have this spread from one person to person, this is what gives way to replication. And I would just like at this time to give you a better understanding as to the outcomes we would like in terms of herd immunity. Okay, so understanding herd immunity. So you can just look at the screen at this time. Next. Okay, so at the diagram that you are seeing in front of you, to understand herd immunity, you must focus on infection, the ability of a disease or one person who has a disease to infect a certain amount of persons. So let's look at the beginning of the chart. We look at the common flu. If someone had the common flu, they are likely to infect 1 to 3 persons every time they come in contact or in a group with persons. So everyone would have a flu if they do not exercise the necessary protocols of hand hygiene, wearing their mask, sanitization. There's a risk of infecting 1.3 persons. Let's look at COVID, which is the middle. One person who is infected with COVID has the likelihood of infecting 2 to 3 persons. So that means anyone who is infected with COVID-19 and they go into a crowd, then there's a likelihood that they can infect 2 to 3 persons. And then these persons who are now infected can now infect 2 to 3 persons. So you can understand how this infection will move to the community. Next slide. Herd immunity is the direct protection of community or non-immune persons from an infectious disease because of the presence and the proximity of the immune person. So each one protect oneself, and together we protect each other. So in terms of Dominica perspective, to achieve what we call herd immunity, we have to vaccinate at least 70% of our total population. In a population of about 72,000, 70% would be 50,400 persons. Given right now the vaccines that we have are for 18 years and older, that means we would need to roughly vaccinate 42,406 persons. Move on. Now, I just want to say to you why your choice matters to others. And this is a perfect example or diagram of how this herd immunity works. If you look at the top of the screen, you will see that the population is represented by 3 colors. The blue represent persons in the population who are not immunized but still healthy. The yellow, immunized and healthy, and the red, not immunized, sick and contagious. Let's look at the first area, where we have a lot of persons who are not immunized, and we have 2 people who are in red who are sick and contagious. What happens is that when no one is immunized, disease will spread for the population. And remember, we just spoke about how infectious COVID-19 is. That means one person can infect 2 to 3 persons in every group they go. Then let's look at the middle. So what happens is that eventually most persons end up getting COVID-19, and we know we may have some deaths from it. Then let's look at the second area where we have only some of the population immunized. So as depicted in the yellow, we are seeing only 5 persons immunized, 2 persons are contagious, and the rest of the population is not immunized but healthy for now. What will eventually happen when some of the population is immunized, then you'll have majority, it will spread for the population, and now most of the population will get infected with COVID. And of course, the final area is what we want to achieve in Dominica. When most of the population is vaccinated, and if you can see it's depicted in yellow, we only have 4 persons who were not vaccinated for some reason, and we still have the 2 people in the population that are infected. What you see happen is that when most of the population is immunized, spread of the disease is contained. And this is what we want to happen. And what is the ultimate goal of having this herd immunity? Is to getting back to living our best life now. Back to the time when we could go and enjoy our jazz and we can go to enjoy Creole Festival. When our elderly can parade the streets in their national wear without masks and the children can participate and look on. Where we can participate in activities like Zoom with our friends and family without having to wear a mask. And also in terms of having different programs and sessions where we can see each other. I hope that assisted you in understanding the significance of herd immunity. In conclusion, I would also like to give a word of caution to those of you who have received your COVID vaccine. For now, please continue to wear your mask and wash your hands and physical distance. Why? Because we have not yet reached herd immunity. You may not get COVID-19, but you may be able to spread the virus. And to our visitors, whether you are vaccinated or not, for now, you too must have a PCR test to enter Dominica. If you come from a high-risk country, you will be quarantined since no country in the world has not yet achieved herd immunity numbers, and we are unsure if you are a carrier of the virus. I also want to take this opportunity at this moment to thank my very staff, health promotion team, my health educators who have been all across the island since March, my communication team, of which Ms. Harry is a part of, and also the hotline staff. So let's do what we must to get back to some level of normalcy. From the Minister and Ministry of Health and my hat to yours, blessed resurrection, and please remember the true reason we observe and celebrate this season. Get vaxxed for you, for us, and for them. Thank you.
And thank you so much to the coordinator of the Health Promotion Unit, Mrs. Mignon Rose Shillingford, for that very comprehensive presentation. And I'm sure many of the questions that we had about herd immunity have been answered by Mrs. Shillingford. And as we come toward the end of our press briefing this evening, we welcome the Deputy Chief of Police, Davidson Valerie.
Minister of Health, Wellness, and New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness, and New Health Investment, Letitia Lestrade-Wyke, National Epidemiologist, Dr. Sheldon Amid, Coordinator Health Promotion Unit, Acting, Mignon Rose Shillingford, Sheena Harry, Communication Officer, Acting, Ministry of Health, Wellness, and New Health Investment, members of the listening and viewing public, members of the media, good evening. I'm grateful at this time of Easter for this opportunity to remind you that the requirements to prevent the spread of COVID-19 in the Commonwealth of Dominica are still enforced. It is necessary now to ensure that more than ever, we continue to observe the regulations pertaining to gatherings at this time. Therefore, the hosting of events must be in accordance with the Environmental Health Services SRNO number 40 of 2020. We have received numerous applications from individuals to host events island-wide during the Easter weekend. Let me emphasize that the Chief of Police must approve any event in the Commonwealth of Dominica where 50 or more people are expected to be in attendance. Applications are available online at dominica.gov.dm. Event applications must be filled in two parts. There is Annex 1 and Annex 2. Organizers must not proceed to advertise their events unless they are in receipt of that approval from the Chief of Police. Section 8 of SR&O 40 of 2020 is instructive. It is illegal for any gathering of 200 or more people. However, many organizers continue to plan events to take place in public places, for example, playing fields, beaches, and other spaces accessible to the public. Permission has not been granted to host some of these events, as the organizers have failed to present measures to successfully restrict or control the numbers of the people in attendance to 199. The requirements for large gathering are not applicable to religious institutions and schools. However, they are to adhere strictly to the protocols established by the Ministry of Health. For example, social distancing, wearing of masks, and hand sanitizing. We are appealing to event organizers and patrons to observe and practice all COVID-19 protocols. The police have the authority to disperse a large gathering, and anyone who disobeys instructions from the police may be prosecuted. Let me remind you to practice the wearing of masks. It is an offense to be found not wearing masks in a public place. Although one may argue that the fine of $75 is minimal, but when convicted, it represents a record against the name. Please obey the protocols. A pleasant Easter to everyone.
And our thanks to the Deputy Chief of Police, Davidson Valerie, and of course to the entire police force for their continued efforts during this COVID-19 pandemic. Ladies and gentlemen, again, we remind you, we urge you to adhere to the protocols, the laws of the Commonwealth of Dominica as we go into this holiday weekend. I want to thank all our presenters this evening, Dr. Ahmed, Mrs. Shillingford, and again, the Deputy Chief. We thank the media partners who continue to provide us with access to their platforms and who continue to offer this great service to bring this broadcast. We thank the Office of the Prime Minister and the staff here for accommodating us, and we wish everyone a very safe and blessed Easter weekend. Good evening.